If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. Welcome to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Massachusetts. Today's topic is triple-negative breast cancer. Triple-negative breast cancer is a type of breast cancer that does not express the typical estrogen receptor or the progesterone receptor or another receptor called HER2. So on the surface of breast cancer cells are these receptors, these docking sites for the two hormones, estrogen and progesterone, and a docking site for something called HER2 or epidermal growth factor. And these are things that normally bind to the breast cancer cell and can stimulate their growth. But there is a type of breast cancer called triple negative that does not, should we say, feed off of those particular compounds, doesn't feed off the estrogen, the progesterone, or the HER2. And so they don't have any, drugs. Well, they have drugs, but they don't have as many drugs, should I say, as they do for breast cancers that do have those receptors. For example, if you have an estrogen-positive breast cancer, then they'll give you drugs like tamoxifen to block your estrogen or Arimidex to lower your estrogen. If you have a HER2-positive breast cancer, they have several drugs, one's called Herceptin, that can block and starve cancer cells from that HER2. But with triple negative, it's basically chemotherapy. There are some newer drugs on being investigated, but it's pretty much go right to chemotherapy instead of any hormonal treatments. But it's more common in younger women than older women, this triple negative, and it is more common in African American women. 39% of all the triple negative breast cancer patients are African American versus 15% non-African American. It's a little more common in that group. If you have this genetic test, like Angelina Jolie had this test, the BRCA1 mutation, it's a mutation of a gene that is a repair gene. It's called BRCA1. It fixes our DNA. So every time we're exposed to some kind of toxin in our environment, or cigarette smoke or anything that can damage our DNA, there's this gene called BRCA1 that can fix our DNA. Well, if you develop a mutation in that, then you're not able to fix and repair your DNA as well, and then your cells can go haywire, and you can develop cancer at a higher rate. And so there is this genetic mutation called BRCA1 that you can get screened for if you have a family history of breast cancer, and consider double mastectomy as a way of preventing future breast cancer. But greater than 75% of the women that happen to test positive for this BRCA1 tend to have the triple negative, which is a more aggressive type of breast cancer too. And that's because they have more genetic mutations. They have mutations in their DNA that allow these cancer cells to proliferate and grow more rapidly than if you didn't have that genetic mutation. 30% of women that are diagnosed with the triple negative can develop metastatic disease. And if they do develop the metastatic disease, just conventional therapy alone, the 1 year survival, median 1 year survival is one year, basically. That's the median survival. But that is just with conventional alone. That's the whole purpose of this show, is to talk about other things that can be done during the chemotherapy, in between chemotherapies, all these things that can be done to help improve survival rates in women with metastatic triple-negative breast cancer and those that have an earlier stage. It does tend to spread more to lungs and brain and liver rather than bones. Typical estrogen-positive breast cancer more likely goes to the bones than the triple-negative. But it is being treated pretty much the same way right now. You're not given tamoxifen or aromatase inhibitors, but if you're diagnosed with triple-negative, then the traditional therapy is adriamycin, which is a chemotherapy drug, and Cytoxan and Taxol. But people with or women with triple negative breast cancer tend not to respond as well to those chemotherapy drugs, and sometimes some different drugs, like a drug called carboplatin, might be a better way to start off, or Avastin, another drug, than your traditional chemotherapy regimen that's given for the estrogen positive breast cancer. Plus, there's also, it might respond initially well to chemotherapy, but then comes back more aggressively later, has a higher rate of a reoccurrence than typical estrogen positive breast cancer. And there's so much they know about triple negative breast cancer I'm going to share with you today that unfortunately is not being addressed. It's pretty much, chemotherapy, maybe a drug for blood vessels, and what's in clinical trial things right now. But there's natural medicines that have been showing some really promising effects. There's actually, triple negative is kind of like a wastebasket term, is that you don't have the estrogen positive receptors, you don't have the progesterone receptors, you don't have the HER2 receptor. But there's actually different types of triple negative, and doing some further testing on the tumor tissue can be useful in determining what kind you have, because some kinds are a little bit more aggressive than others, and that helps determine how aggressively you need to treat a patient. But there's one type, it's called basal-like triple negative breast cancer, which represents about 47% of all triple negatives. And it tends to have a lot of mutations in genes that are involved with cell division. So it has a lot of mutations, and so the cells tend to rapidly divide more than other types of breast cancers and other types of triple negative ones. You think when you have cancer that all the cells are always rapidly dividing, but that's not the case. Cancer cells typically don't divide any faster, or most solid tumors, should I say, don't divide any faster than a normal cell, but they just unfortunately don't die like a normal cell, so they start to accumulate. Like, babies are born, but the elderly never die, so it starts to accumulate the cells. But this basal-like triple negative, maybe about 70% of the cells in a typical tumor are dividing. It's usually only 10 to 20% of the cells at any given time are dividing. But with this basal-like triple negative breast cancer, 70% may be dividing at one given time, because so many genes are mutated in this breast cancer that cause it to undergo this, speed through the cell cycle and start replicating the DNA and divide. So it does make it very sensitive to chemo, because chemo actually kills dividing cells. Chemo doesn't work as well when the cancer isn't really dividing much. It's more resting. So it does actually respond very well to chemo initially, which makes you think, okay, it's gone. But then, unfortunately, the chemo doesn't kill every single cell, and then these rapidly dividing cells come back quicker than your typical breast cancer. So it initially responds well, but then it's short-lived. But there's ways to make it so it's not so short-lived and that it responds even better to chemo. So I'm going to talk about that later. There's another type called the mesenchymal stem cell, stem-like breast cancer, triple-negative breast cancer. It doesn't divide as rapidly as the basal-like, but it does have a lot of growth factor pathways that get overexpressed. So it does have a lot of, should we say, docking sites for growth factors that stimulate blood vessel growth. And so these all can be tested, so you can customize the therapy to the patient instead of everybody with triple negative gets chemotherapy, that you customize therapies for them based on their genetic profile of the cancer. Do they have this gene overexpressed, that gene overexpressed? And I'm going to tell you how natural medicines can fit into this later. Then there's another type of triple negative where it's basically kind of feeding off of androgens. Androgens are hormones like testosterone, DHEA, androstenedione. They're classified as male hormones, but women have them too. But there's one type of triple negative called the luminal androgen receptor type, where the androgen receptors, the binding sites for hormones like testosterone, may be 9 times higher expressed than other types of triple negative. And so this type might respond to drugs or natural compounds that inhibit the androgens. But these things aren't typically tested in women that are diagnosed with triple negative breast cancer. They say, okay, you don't have the estrogen receptors, so you got to start maybe some type of chemotherapy, and definitely chemotherapy if you have the metastatic. But in terms of the type, basal-like, mesenchymal, luminal androgen, I don't see that typically done. But it's important from a natural perspective and even for clinical trials if a person's going to go down that road. Okay, now, so the first line therapy for a woman that has metastatic triple negative is chemotherapy, or if they have positive lymph nodes, more locally advanced triple negative disease than chemotherapy. But there's some women that just caught it early. It was, they found a lump and it was tested, and the lymph node, it didn't spread to any lymph nodes, but they still may need chemotherapy. But the typical test that's done to determine whether they can benefit from chemo or not is called the Oncotype DX. That is found to be not accurate for triple negative. It's not accurate. It's for triple negative. It's useful for women with estrogen-positive breast cancer, where if they have negative lymph nodes, they do this test, Oncotype DX, and if the score is above 20, then it indicates that they would benefit from having a course of chemotherapy or 4 courses of chemotherapy after the surgery or before, sometimes, depending on the size and stuff. But doing it after to determine if they're going to benefit from chemotherapy or not. But they find that's not useful for triple negative, that there's a better test called PAM50, PAM50, by a company called NanoString Technologies. And the reason why this is more accurate is it does check more genes than the Oncotype. That's what these tests are doing. They're looking for genetic mutations, genetic abnormalities, to see how aggressive the cancer is, and is it more likely to reoccur after surgery, and if there's certain genes that are more overexpressed or underexpressed, then it indicates that they would benefit from chemo. But the Oncotype DX only checks 21 genes. It doesn't seem to be enough for triple negative. The PAM50 checks 50 genes. But triple negative, especially the basal cell, the basal-like triple negative, does often respond well to chemotherapy initially because so many of the cells are dividing. And so there's this test called the Ki-67 index that's typically done. Anytime you have surgery, they measure that as part of the pathology, besides checking estrogen receptors and HER2. And Ki-67 index, the higher it is, the more the cells are in a DNA replication phase where they are replicating. And they find that women that are more likely to respond to chemotherapy have the Ki-67 index at least over 57. And they tend to do that with the basal-like cancers. So, but the goal with chemotherapy is to induce what's called a pathological complete response. Whereas if the chemotherapy is started before surgery, that the cancer shrinks so much so that when they go in there and look for cancer cells, they can't find any cancer cells left. That's called a pathological complete response. Completely disappeared, being looked at under the test tube. That is the goal. The women that have a good pathological complete response are more likely to have longer survivals. It doesn't mean it might be completely gone, but it's more likely to be completely gone if it's completely gone under a microscope. It is that's the goal. So the typical regimen, I mentioned adriamycin and Cytoxan and Taxol, doesn't seem to work as well for triple-negative breast cancer, but it's still being offered a lot. They've done a presentation at the American Society of Clinical Oncology in 2013 where they used that regimen and caused a complete pathological response in 39% of the women. But when they tried a different regimen, what's called carboplatin, a different chemotherapy, along with the Taxol, and added a drug called bevacizumab, which is also called Avastin, the pathological complete response was 64%. So 39% for the typical regimen versus 64%. And like I said, the higher the pathological complete response, the more likely that the cancer won't come back and the longer survival. And this bevacizumab drug blocks some growth factor called Avastin, which the triple negative tends to be very only overexpressing blood vessel growth factors. And so that also makes a difference with overall survival, having that. But unfortunately, even with this regimen, carboplatin, Taxol, and bevacizumab or Avastin, if the woman has metastatic triple negative at diagnosis, the regimen only typically lasts for about 9 months before it starts to progress. That's average, and that's with chemo alone. And if it was caught early and the breast cancer was just locally advanced, so there was some lymph nodes involved but no metastatic disease, it certainly can work better, but 55% start to progress after 7 years. So it can be way down the line, but still 55% might have some progressive disease within 7 years. So clearly, more needs to be done to achieve even better results. So the first thing that I would look at is there's been some research done in England using a compound called arginine. Arginine is an amino acid. It's found in protein. So every time you eat protein, it contains these amino acids. Well, they found that breast cancer, triple negative breast cancer, takes this arginine and converts it into something called ornithine, which helps stimulate DNA replication. Like I mentioned, chemotherapy works best against dividing cancer cells. The higher that Ki-67 index, the better it will respond to the chemotherapy. So if you raise the Ki-67 index before or right before the chemotherapy is given, the cancer typically will respond better. But then, as soon as the chemotherapy is finished, you want to lower the Ki-67 index to as low as possible so the cancer cells don't start dividing, the ones that weren't killed, that is. So that they've done a human study. They first just gave arginine for 3 days, a pretty high dose, about 30 grams of this arginine a day for 3 days. Then they did surgery with women with the breast cancer, and they found out that it increased the Ki-67 index just after 3 days from 5 to 18% to 28 to 68%. So there's a pretty varied response, but on average, there was an improvement in the Ki-67 index. So then they did a second study in the International Journal of Oncology in 1998 where they gave 96 women with locally advanced breast cancer chemotherapy plus the arginine, or just chemotherapy alone, and found out that 88% of the women that got the arginine with the chemo, when they went in to look at where the breast cancer was, it was moderately to highly destroyed. Not a pathological complete response, but close to it, versus 52% just given the chemo alone. And then the complete pathological response was 14% versus 6% in the chemotherapy alone. So doubled the complete pathological response. And that was just 3 days before each chemo. So that's what's typically been studied is 3 days before each chemo, a woman takes this arginine, 30 grams, and then stops it. Chemotherapy does its work, maybe kills more cells with the arginine. Then you repeat it again 3 days before the next chemo. Unfortunately, there's been no follow-up since 1998 to see any larger studies, but it was some really encouraging stuff. And the data says that the better the complete pathological response, the better the results to the chemotherapy at the beginning, the more likely the woman will stay in a remission later on. Okay, I got to take a break, and when I get back, I'm going to talk about some more natural compounds that might make that chemotherapy work better. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from Lexington Natural Health Center. Before the break, we were talking about natural compounds like arginine, which may improve the results for chemotherapy against cancers like triple-negative breast cancer. The typical regimen given for triple-negative breast cancer includes adriamycin, Taxol, or Taxotere, and a drug called cyclophosphamide. I mentioned there's another regimen, carboplatin, with the Taxol and bevacizumab, which might be better, but I haven't seen it being commonly used just yet. But Taxol is a common drug for both regimens, And there's research showing in the Breast Cancer Research Journal 2010 that a compound from green tea called EGCG can make Taxol work better. So they gave Taxol alone to animals that had breast cancer. They didn't mention triple negative or not in this study, but it was just breast cancer, Taxol alone or Taxol plus the EGCG from the green tea. And after 28 days, the tumors were 1/2 to 1/3 the size in the group given the EGCG with the Taxol than Taxol alone. And it's also been shown to enhance the platinum drugs. So, and adriamycin if that's used. But like I said, the carboplatin does seem to work better according to some new data, along with Taxol. And EGCG looks like a very promising supplement to improve the results because if a woman has metastatic triple negative, even carboplatin with the Taxol and with this drug Avastin, the progression-free survival is 9 months, meaning it works for 9 months and then it stops working. And adding anything to it that might make it work better should be studied more. And EGCG looks like a very promising compound. The other thing that looks very promising is curcumin. Curcumin is that compound found in turmeric, that Indian spice. It represents about 20% of turmeric, so not all turmeric is curcumin. And at the MD Anderson Cancer Center in Texas in 2005, they gave women, now this one was an estrogen-negative breast cancer study, where they first did surgery to remove the tumors. 5 days later, they added a very large amount of curcumin, what's an equivalent of, in person to 18 grams. Now, they used just a regular, what's called C3 complex curcumin, which they now have all kinds of more absorbable forms of curcumin, so maybe 18 grams is not necessary anymore. But in this particular study, they used a lot. Still, one curcumin pill is probably not going to do it. It has to be a pretty large dose. Well, they gave it to these animals' diets for 5 days before they started chemo. Then they started chemo, and they gave Taxol every week for 3 weeks, or they just gave curcumin alone, and then they 5 weeks after they removed the tumors, and the group that got curcumin plus the Taxol, 4 out of 15 had metastasis to the lung. Like I mentioned, triple negative can be highly metastatic, and it can go to places like the lungs. 4 out of 15 developed metastasis in the lungs in curcumin with Taxol. Curcumin alone, 8 out of 15 developed metastasis in the lungs. And Taxol alone, 12 out of 15 developed metastasis. So it really didn't help that much, the chemo alone. Still, majority of the animals developed metastasis to their lungs, but a lot less with the curcumin. So another interesting thing, maybe paired with arginine, paired with EGCG from green tea, then the results may be even better. But curcumin has been studied with carboplatin as well, and making that work better too. So it would be a really interesting study to do. Somebody needs to put some money into that. They also found that triple negative, because there's often so many defects in genes, that it's very common for triple negative breast cancer patients to have a lot of breaks, they call it, in the DNA, damage to the DNA, and where they can't repair the DNA. Like I said, over 75% of women that have that BRCA1 mutation tend to have triple negative. BRCA is a repair gene, so they can't repair their DNA as well, so they have a lot of defects in the DNA, and that's what makes often the cancer more susceptible to carboplatin, because carboplatin damages cancer DNA, and that induces death of the cancer cell. But there happens to be this other repair system. If the BRCA is mutated, cancer still can fix itself from the damage from the chemotherapy with something called PARP. PARP is an enzyme that we all have present in our body, and it fixes our DNA. So cancer cells just use it, just like a normal cell would, to fix the DNA after being damaged by chemo. And that's one reason why the chemo doesn't often kill every single cancer cell, because it can fix itself. But it's more likely to have a harder time fixing itself if there's the BRCA mutation, because then it doesn't have that gene to repair. But there's still this PARP, and so they've done studies combining chemotherapy with PARP inhibitors. But there are natural PARP inhibitors that are in our environment that are looking very promising. There's one found in this mushroom called cordyceps, called cordyceptin. It's a compound found in this mushroom cordyceps. This mushroom grows on the head of a caterpillar. It's pretty funny. And it looks like a lung. So they've used it for lung diseases of different kinds. But anyhow, it's been studied in Louisiana where they found that it was a PARP inhibitor. And it's been given orally and shown that it can reduce tumor volumes, and there are extracts out there where there's cordyceps that are standardized for cordycepin. That's the thing. There's cordyceps mushroom products all over the place, but they're standardized for other things called polysaccharides and adenosine. This particular research that's been done says the cordycepin component of the cordyceps mushroom is the PARP inhibitor. And there's a company, Canada RNA, that does standardize their cordyceps for cordycepin along with polysaccharides. And the research says you need a pretty large dose, maybe equivalent of 20 milligrams of cordycepin, which it can be a large amount. But looking very promising, and it's certainly very well tolerated, this mushroom, and also has the added benefit of helping the immune system fight the cancer, because the polysaccharides in the cordyceps have an ability to boost natural killer cells, which is very useful too, unlike the drugs that are PARP inhibitors. So it's very important to do some genetic testing on all women with triple-negative breast cancer, either sending the tumor for some more testing to see what type of triple-negative and what genes are over or underexpressed, and then actually combining that information to determine a individualized treatment plan. But that is not being done right now. Like I said, it's pretty much chemotherapy, and then if it wears off and it comes back, then more chemotherapy, maybe a clinical trial. If a woman has a locally advanced breast cancer, then they go on chemotherapy for a period of time, then they're done, and that's it. They don't go on to tamoxifen or aromatase inhibitor because the cancer is not sensitive to estrogen. What do you do in that interim? You do some natural medicines to help prevent it from coming back. But there's this lab called RGCC, which I've mentioned in other shows, that they are a lab in Greece that can isolate cancer cells from the blood. So it's another important thing, too. If you go through all this chemotherapy and they're still finding cancer cells in your blood, it means that you want to continue with some kind of therapy, whether natural or conventional. A lot of doctors aren't using that test right now, looking at cancer cells in the blood. But research is showing that if you still have cancer cells in your blood after chemotherapy is finished, you're more likely to get a reoccurrence somewhere, liver, lungs, local reoccurrences. But RGCC does check it in the blood to see if you do have that. But then they do a step further where they take those cells that they found in the blood, they grow them, and then they analyze it for all kinds of genetic abnormalities. Well, one of the things I mentioned that triple negative tends to do is it has more cells are proliferating, more cells are cycling, dividing, replicating the DNA. And RGCC will actually check different genes that are involved in DNA replication and cell cycling, they call it, the movement of a cell from a dormant phase to dividing in half. And so there's all these genes, E2F1 and P27 and P53 and P16. They're just things that are involved with cell cycling. And they'll check them all at RGCC to see if you have them and if there are certain ones are overactive or underactive, and determine just how much your cells are dividing. Because the faster they are dividing, the more likely the cancer can progress and or come back if it's looking to be in remission on any scans. Well, there's natural medicines that have been shown to shut down the cell cycle. Like I mentioned, you want arginine in there with chemotherapy to turn up the cell cycle, because chemotherapy kills these cancer cells that are replicating. The cancer cells that are in a dormant phase can, shall we say, hide from the chemotherapy and come back out later. Like it's almost like they're going into a spore form, just like a fern or something goes spore forms, and then when conditions are right, comes out of the spore form. Chemotherapy, we want them to come out of the spore form so that they'll be killed by the chemo. But then once the chemo is over with, then if there are cells that were not destroyed, you want to shut them off. And that's why you want to measure the cell cycling. And there's compounds found in broccoli called sulforaphane. Sulforaphane is a compound found in broccoli, and it's very high in broccoli sprouts, where you take the seeds of broccoli and you sprout it. And they've been doing a lot of research on this compound at Johns Hopkins, finding that it can shut off the cell cycle in triple-negative breast cancer cells. So again, you can do a test at RGCC to see how active the cells are cycling, how often they're dividing. Use sulforaphane as one of the natural compounds in the mix there, and see a repeat test if things have calmed down or if the cancer cells are there at all. Period. And so the sulforaphane is looking as a really promising compound. It's rapidly absorbed. It does come in pills. I mean, you certainly can get it out of broccoli sprouts too, but you never know how much is in each batch. They do have it in a pill form. It's very well tolerated and does seem to shut off the cell cycle. The amount that they've been using in the research is equivalent to about 500 milligrams. Most of the pills that I've seen are 50 milligrams. So it's one of those things that looks promised, but dose is really important. Sulforaphane does also seem to help the natural killer cells, according to some data. So it might have a dual effect, or even more than two effects. It might even stimulate cell death of cancer cells. Then there's something in garlic. So a lot of the research says that if you're going to eat foods, the best foods to eat are the cruciferous vegetables, especially things like broccoli sprouts. Broccoli sprouts are better than broccoli because broccoli, as soon as it's cut, that sulforaphane starts to reduce. And so if it's being shipped in far away, sitting in the grocery shelf for a week or something, it's going to lose a lot of its anti-cancer properties. If you grow it in your own garden, cut it right there and eat it right away, then we're talking it's going to be good. But broccoli sprouts, you can sprout them in your own house. You buy the seeds, you sprout them, eat them, sprout some more. It's very easy, and you get sulforaphane right away. But Brussels sprouts are high in sulforaphane and other compounds, and kale and collard greens. And those vegetables don't respirate as much. They don't tend to break down as much. And you can get kale and stuff often locally. Well, if you live in Massachusetts here in the wintertime and stuff like that, more likely to get that than broccoli coming from California. Okay, garlic, though. That's the other family. Garlic, onions, scallions, shallots. Those have a lot of anti-cancer properties. What they studied, triple-negative breast cancer given to these animals, and then giving them a freeze-dried water extract of garlic. And they used a particular type of garlic called Allium sivasicum. It was a study done in Turkey. And it was equivalent to about 1,000 milligrams of this garlic. And the tumor volume was reduced by 38%. And it reduced the number of dividing cells by half. See, so it's something, after chemotherapy is over with, to shut down those cycling cells. Among that, plus the sulforaphane and some other things I'm going to talk about. And it quadrupled the number of cells in the tumor that had undergone cell death. And this is just, 1,000 milligrams of garlic, which, it can be just a few cloves, or they just like 2 pills. They have pills often that are like 500 milligrams. If you cook with it, though, you need to let it sit for about 10 minutes. If you chop the garlic and you cook it right away, you're going to destroy its anti-cancer compounds. But if you let it sit for about 10 minutes after you chop it up or crush it, then it will be preserved even with heat. But raw garlic, you can just eat the thing right away. Okay, there's something in clove. Clove, it's also found in bay and cinnamon, so another food-based compound called eugenol. It's essential oil. It's something you smell when you smell the clove and the bay and cinnamon. And it has also been studied, the British Medical BMC Cancer Journal, I'm not sure what that stands for, in 2013 in Saudi Arabia, where they gave mice a type of triple-negative breast cancer called the mesenchymal, and they allowed it to grow until it was a couple centimeters in volume, and then they gave a group this eugenol, and they also gave just a control, and they measured how much it grew, and it barely grew at all in this eugenol after 4 weeks, where it tripled in size in just the control group. And how did it work? It downregulated a lot of the cell cycling. So it shut the cells off. It kept them from replicating. Now, it was done on this compound, eugenol, rather than clove itself. But they have found that eugenol is very well tolerated given orally. They've done studies on it. It doesn't cause any abnormal effects in lab tests. They've done studies, so it looks like a very promising thing. It's typically, given to numb your gums or something for dental, clove oil. But this study has, checked it orally and found that it seems to be fine that way as well. Certainly using these spices, you'll get some eugenol. Might not work the same. And then there's another compound. Now, this compound is found in the squash family. There's a compound called curcubatacins. Curcubatacins is found in squashes like zucchini. It's also found in cucumber, which in that same family, and melons, including this melon that they eat in China called bitter melon, which it looks like a spiky cucumber but tastes bitter, and it's part of the cuisine. You might have heard that lately because they're finding that this bitter melon is very good for diabetes. Well, they found that this compound in this squash family can also cause inhibition of the cell cycle in triple-negative breast cancer, and bitter melon might be the highest source of this because this compound, curcubatacin, is bitter. So, zucchini doesn't taste that bitter, but the bitter melon does. So it does have more of this. So they've actually studied bitter melon by itself, and it's been also shown to inhibit the cell cycle. So that's the way I like to use it, is a whole thing, a whole food, rather than an isolated constituent. And you can buy a bitter melon at a Chinese grocery and often juice it, and you can add things like other melons to it, and orange and things to help it more palatable, or it comes in a pill. But it's looking very promising against triple negative because it inhibits the cell cycle. And these are animal studies, not human studies, but at least animal studies showing that it has an effect. Okay, I'm going to take another break, and when I get back, we're going to talk about vitamin D. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. So I've been talking about natural compounds that can stop a lot of triple-negative breast cancer cells from dividing, replicating the DNA. And this is really important, especially after chemotherapy is given, to keep any cancer cell that was not destroyed by the chemotherapy from starting to replicate again and come back later. And there are some tests that can be done to see if you do still have some cancer cells in the blood after a chemotherapy course, and if they are replicating more rapidly. That test is done by a lab called RGCC in Greece. Vitamin D is one substance that slows down the cell cycle of cancer cells. If you're deficient in vitamin D, the cancer, if you have the triple negative, is more likely to be replicating and proliferating. Because there's research showing where they measured vitamin D levels, and you measure something called the 25-hydroxy vitamin D in the blood. Women with triple-negative breast cancer versus the regular estrogen-positive breast cancer were more likely to have a lower vitamin D level. Like I mentioned, the triple-negative often replicates faster than your typical estrogen-positive, and part of it might be because of vitamin D deficiencies, because vitamin D inhibits the cell cycle, the replication of DNA. And that there's that type of triple-negative that is the one that replicates the fastest, the basal-like type of triple-negative. Vitamin D was even more likely to be lower in the blood, 3.8 times more likely to be under 20 in triple-negative breast cancer patients than non-triple-negative. There's some research on that. So very important, having the vitamin D blood level checked in all women with breast cancer, especially triple-negative, and making sure that they are not deficient. There seems to be a different opinion on what's the optimum amount of vitamin D in the blood, but I usually like to go for a target of about 50 nanograms per ml A typical normal range, they say, is 20 to 100, but in most of the research studies, they say at least 32 is optimal. And when it's under 32, there's a higher rate that it's going to be in a more proliferative state. The cancer is going to replicate more. So checking that, getting more sunlight, taking vitamin D pills, or your fatty fish and mushrooms are food sources of vitamin D. Any kind of mushroom has vitamin D2, and fatty fish like salmon, mackerel, herring, and sardines are rich sources of vitamin D3. Okay, so besides checking cell cycle, the RGCC lab will also check what's called growth factor pathways. So the cancer is growing. It's not using estrogen, it's not using progesterone or HER2. What's it using? Well, it has binding sites on it for other growth factors besides estrogen, and there's a whole host of them, and it depends on the person, the type of cancer that they have. So RGCC will take the cells and test all the different growth factors and pathways and see which ones are being overexpressed and utilized more by that person's cancer. So some of them include VEGF, vascular growth factor, PDGF, platelet-derived growth factor, EGF, epidermal growth factor, FGF, fibroblastic growth factor, something called MMPs, matrix metalloproteinases. Basically, the cancer is feeding off of a lot of different things besides estrogen, and you find out what those things are. Its fuels, its favorite foods, and you do things to take it away. But you have to take them all away. They've done studies where they try, just one drug. Like I mentioned, this Avastin or bevacizumab does take away one thing from the triple-negative breast cancer, the VEGF. It adds actually a couple months to progression-free survival, so that it doesn't progress as rapidly another 2 months. But it's not, miraculous because it only takes away one thing from the triple-negative breast cancer, and it could be using a bunch of stuff like I just listed. So this is where natural medicines come into play because no doctor is going to give a patient an inhibitor for every single thing that they test for because there would be too many toxicities. But there are natural compounds that can be blended that are often very well tolerated that can deal with a lot of these growth factors that aren't being addressed at all in a woman to help starve the cancer completely. Well, some of these growth factors actually produced by a woman's own immune system. Cancer cells, how come they're not being destroyed by the immune system? Why, they're sitting there and they're growing and they're not being detected? Well, that's because the cancer can attract something called M2 macrophages. M2 macrophages are immune suppressive cells, and they inhibit killer cells from attacking the cancer. And they also make growth factors that stimulate blood vessels. So they find that triple-negative breast cancers can be surrounded by these M2 macrophages. And it's because the cancer cells start to make or induce the production of something called COX-2. It's one of the mutations. COX-2 is an enzyme that can get overexpressed in triple-negative breast cancer, and it causes the production of something called PGE2, prostaglandin E2, which attracts these cells that we have in our body, these suppressor cells, and converts other types of macrophages, M1 macrophages and M2 macrophages, and then it takes your own immune system and uses it to fuel itself. So that's kind of, it seems contradictory to some people, the immune system helping the cancer grow. But there's like two categories of immune cells, cells that help the cancer grow, protect the cancer, like a set of guards, and those include M2 macrophages. And then there's cells that destroy the cancer, like M1 macrophages and type T1 cells and natural killer cell type 1 cells. So there's some, but a lot of it relates to this COX-2. So they found that if you inhibit COX-2, then a lot of these M2 macrophages disappear. Well, curcumin is a very strong COX-2 inhibitor, which is looking very promising. I mentioned some compound found in clove oil called eugenol, has been studied in vivo in animals with triple-negative breast cancer, completely inhibited the COX-2 enzyme. It wasn't overexpressed. It totally shut it down. And that's going to be really important to get those M2 macrophages out of there. So more research should be done on eugenol from clove oil. Okay, so now let's talk about these individual growth factors. So sometimes breast cancer is utilizing something called epidermal growth factor, and it will have an overexpression of binding sites for this growth factor, epidermal growth factor. So it's frequently overexpressed. Well, you test it. If it is overexpressed, there's this herb called graviola that looks very promising. It's been studied for triple-negative breast cancer in animals. It's an Amazonian fruit tree, and it's the fruit that's used rather than the leaves. Sometimes studies use the leaves, but in this particular study in the Nutrition and Cancer Journal in 2011, they used the fruit. And 32% reduction in triple-negative breast cancer after 5 weeks. And when they analyzed the cancer in the animals, it inhibited the expression of epidermal growth factor receptors by 56%. So it looks very promising as something. If the woman has that overexpressed, maybe graviola would be a useful herb for her. Indole 3-carbinol, this is another compound found in the cabbage family vegetables. I mentioned sulforaphane found in the broccoli sprouts. Indole 3-carbinol is another compound found in all kinds of cruciferous vegetables, and it has also been studied with triple-negative breast cancer, causing a marked reduction of EGFR. So if a woman has that positive, indole 3-carbinol has been shown to markedly reduce that in at least animal models. And they've studied it for a type mesenchymal triple negative, which tends to have an overexpression of EGFR, and it reduced the tumor volume by a half. Another thing that has been studied is sulforaphane. The same thing that's in the broccoli sprouts has been studied for EGFR too. So that's something, a way to target the natural medicines. Well, that's not the only thing that may be over-amplified. There's something called FGF, fibroblastic growth factor receptors, can be overexpressed. That's something RGCC will test for too. Very commonly overexpressed. If it is, this is where omega-3s come into play. Omega-3s found in fish oil and flaxseed oil. There's an interesting study done in International Journal of Cancer in 2005 where they gave these animals triple-negative breast cancer, the mesenchymal one, the one that's more likely to have FGF receptors overexpressed, and they gave them corn oil, which is high in a fat called omega-6, and then they gave them more omega-3 than omega-6. And it grew 6 times the volume in the group that had the omega-6 versus the omega-3. Now, omega-6, you might say, well, I don't eat that. You probably do. They feed corn to animals now, and so corn has corn oil in it. And so a lot of the fat that we are ingesting on a daily basis is omega-6 fat. For example, you have, some milk or cheese from a grain-fed animal, a corn-fed animal. It's going to be high in omega-6 fats. You eat meat from a corn-fed animal. It's going to be high in omega-6. You have vegetable oils, soybean oil, and a salad dressing in a baked good, vegetable oils and baked goods. You're going to get omega-6. So our diet is littered with omega-6 fatty acids. Like this study, they gave more omega-6 than omega-3. We have very little omega-3 in our diet. We would if we ate grass-fed meats, pasture-raised eggs and chicken, and certainly more fatty fish and flaxseed oils and flax seeds and chia seeds and those things. But I always encourage anybody with cancer, including the triple negative, to get the omega-6 out of the diet as much as possible. You're not going to get it out entirely. You need some omega-6. It's an essential fat, but we want to have more omega-3s, or at least equal proportions. Okay, VEGF is another growth factor, vascular growth factor. Often overexpressed. Triple-negative breast cancer tend to be highly vascular. It likes a lot of blood vessels. That's why they're using this Avastin drug. But there's more than just VEGF that leads to blood vessels. But green tea looks very promising as an inhibitor for VEGF. And it's something that can be tested at RGCC. You can even test VEGF in the blood. You want to make sure that is as low as possible, because Avastin is a very useful drug if VEGF is overexpressed, but it gets, should we say, diluted out if the cancer produces too much VEGF. The lower you lower VEGF, the better Avastin will work. So green tea plus Avastin looks to be a very useful mixture, because green tea decreases the amount of VEGF and Avastin blocks VEGF. But there's many things that induce VEGF, and over time the cancer can try to override Avastin and green tea, and it induces the production of VEGF by making that EGF and making IGF and other growth factors. So we mentioned graviola, indole 3-carbinol affecting EGF, so that can be useful too. But IGF is another compound, and some women with triple negative, they find that it might be related to what's called metabolic syndrome, eating too many carbohydrates. Insulin growth factor can stimulate the growth of triple-negative breast cancer. And when you're eating a ton of carbohydrates, especially the white stuff, the white flour, the white rice, you tend to produce too much insulin after a while. And that high levels of insulin circulating in your body can bind to breast cancer cells, triple-negative breast cancer cells, stimulate their growth. So there's papers written on, they call it metabolic syndrome and triple negative. So I always encourage to cut out a lot of those carbs, eat mostly those, cruciferous vegetables, green leafy vegetables, nuts, seeds, fish, kind of more like the caveman kind of diet, hunter-gatherer, gather-hunter, less of the carbs. Because the other thing that carbs do is they increase the production of what's called androgens in the body. Androgens like testosterone, DHEA. And they find that many triple-negative breast cancer cells overexpress the androgen receptor. And so especially this type, the luminal androgen receptor. So that's something that you can test at RGCC. If it comes back elevated, then more reason to watch the carbs. So I've seen like two groups of women, some that are, overweight, eating a lot of carbohydrates, more belly fat, and then a group of women that are extremely fit, very, addicted to exercise, no fat on their body, lots of muscle, and, they get this triple-negative breast cancer. They're a symbol of fitness, too. And it's kind of interesting that this androgen receptors play a role. Maybe they just need some estrogen in their body. And without fat tissue, you don't make any estrogen, or not as much estrogen, should I say, and you might have a higher ratio of these androgens to estrogen, because fat tissue converts androgens into estrogen. If you have no fat on your body, you're not going to make as much, so you might have more androgens in your body. If you have too much fat, then you have more estrogen, and that could stimulate estrogen-positive breast cancer and insulin growth factor. So somewhere in between, somewhere in between. But there is that is involved with that. So that might be why there's these two groups of women that tend to get the triple negative too. But there is this mushroom called Copernus comatus that looks very promising if there is an androgen receptor issue, because it can really inhibit and reduce androgen receptors. It has been studied at my university, the university I went to school, Bastyr University out in Seattle. It's in Kent, Washington now. Did a study where they screened a whole bunch of mushrooms against triple-negative breast cancer, and this Copernus comatus, the shaggy ink cap, looked very promising. Marked growth inhibition of triple-negative, and its mechanism is affecting the androgen receptor. Soy also looks very promising. Soy, recent data says it's not contraindicated for estrogen positive, but it's actually very indicated for estrogen-negative breast cancer. There's numerous studies showing that it can increase cell death of this androgen receptor-dependent triple-negative breast cancer. It can, it's a potent antagonist of the dihydrotestosterone, the type of testosterone that binds to the androgen receptor, stimulating the cancer growth. And there's different compounds in soy, genistein, diazine. They're more absorbable in the fermented forms like tempeh and miso. So that's looking very promising. There's also, I'm running out of time, but blueberries and black rice. There's compounds in black rice, those pigments that are in black beans, blueberries, blackberries, anthocyanidins are looking very promising too. So it's a good thing to eat those and even taking extracts. Well, I hope you enjoyed today's show. I'm going to talk about melanoma next week. This is Cancer Concepts and Compliments. I'm Dr. James Belanger.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.